Can you tell me more about your previous or current research, and did you do any research in connection to the HTE products?
Oh, yes, exactly. Now I have 4 years, around 4 years, after using the 1000 e-power. And now I'm writing a book, and I'm going to present my research investigation about 4 years the usage of hot house and e-power in my technique and feedback. And I'm going to present this conference in Mexico, and in that I'm going to give to all people my results about good success, about around 97, 91, 96% of success in the patient. And I feel something because I'm going to speak with doctors, and doctors don't believe in that. But anyway, no problem for me, because I every time say, for me the most important is my patients. And some people in Canada told me about Dr. Cabriales, what the doctors said about this, and I said, I don't know, but I consider, but if my patient is right, if it's my patient, I avoid the amputation. I say, it's okay. I'm considered, and it's very important, the function and the works by the other doctors. But for me, what I'm doing is sufficient to can speak clearly and strong, and very happy to say to all doctors to my success in 4 years of experience in diabetic food. But for the other side, I make the work as research work about the e-power, and it's very easy to do it, because too much people say, Dr. Cabriales, I don't feel nothing with e-power. And other people say, I'm a super doctor with e-power. And I said, okay, you're gonna see what happens, what happens. And I take in my patient, 50 patients with diabetic food, diabetic patients, and 50 patients not diabetic. And I see, use it 30 minutes. And I make this work. And I see, but there is a real change of decrease the blood sugar levels around 15 to 50%, 15 to 50 milligram by deciliter in 30 minutes.
Even so you're able to lower blood pressure and blood sugar in 30 minutes on high.
Yeah, because I put in the finger a punction, and I made the straw sticks, but it's something that every people can do it. And I count, and I take the patient and say, gonna see what happened if I use it e-power, and if I don't use it e-power. And I see exactly with numbers writing before and after finish, and see the change in 50 patients. And I see it's real. There is a real change, because there is a decrease of blood sugar around 50% 50 milligram per deciliter in 3 minutes, even if the people feel or not feel nothing. And for me, it was very nice to express to people with numbers, because too much people can say, I feel nothing, but it doesn't matter. If you feel something or not feel something, the real thing is that there is a real change in your body. For that, for me, it was very important, very nice, and I'm going to present at this conference. And this is for the one side. And for the other side, too much people, but I see in different parts around the world, especially here in the United States or Canada, about the problem, big problem about the fibromyalgia and multiple sclerosis. And I made a research investigation about the, again, hot house and e-power with fibromyalgia. And I see a real change about there is a decrease of his symptomatology, about there is less fatigue, because too much people with fibromyalgia have the principal problem is the pain and fatigue. And the hot house helped too much to decrease the pain, and the e-power helped too much to decrease the fatigue. And for the other side, there are so many investigations about the principal problem of fibromyalgia, and people say it's an immunologic problem, or etc., or problems in the information of the nerves. And so the power, I see, but change his information in the nerves, and can't help too much to avoid the fatigue. For that, I have different investigation, and now I'm working too hard in the investigation about breast cancer. And that will be very important because it's right now, not for me, but every in the world, there is a real change about the infrared, far infrared light, about the have a selective destruction of the cancer cells. And for me, it was very interesting. In the research information, it's about the infrared light or red, far infrared light. And I said, if we have the hothouse, we're going to see what happens. And now I'm working in this situation because I'm considered it will be a very nice surprise for me and for all patients, and have a good results with the utilization of hothouse with the breast cancer, because it's too close here, and you can put it in the dome and gonna see what happens. And I'm working in Monterrey, in Mexico, about this, but unfortunately now I cannot give you my results because I'm working in this moment. So I'm very excited to only the possibility that will be a change, for me will be very nice.
And I can just back up what you're saying. I'm not a doctor or anything, but I've got a lot of experience with these machines. And over the course of the last 14 years, I've had numerous women with breast cancer use the hothouse. And after 65 hours of using it, they're reporting back to me that they can't find the cancer anymore. So these are all stories I'm hearing back. So it'll be nice to have the research that you do verifying what I know is true, but you have the research then.
For me that's the most important. I believe in people, in the testimony people, I believe. But if you make some research investigation, the most important is to have something, to have a comparison with or without not. And the most important research is the double blind. But in this moment, in this situation, it's difficult because it's obviously, but the people see the hothouse, and it's impossible to be blind. But the most important is to have some quantity of patients, use it, and some people, but have the normal therapy, chemotherapy, surgery, etc. By the way, I treat the patient with this hothouse. I remember that when she comes with very first time with me, I see a little problem. She is very nervous, and she said, "What happens?" And I say, "I need to do some biopsy," and I make the biopsy, and it was unfortunately cancer, breast cancer, real, because I see and I recommend a pathology. Tell me, okay, it's cancer, and I tell her. She tell me, "What are you gonna do, doctor?" And I say, "We need to make that mastectomy, the surgery of the breast." And she cried, etc. And she said, "What can I do now?" And I tell her, "Please use this device, hothouse." In the literature, in the scientific literature, said about can be useful. And she used it for 20 days, 1 month after biopsy. And she come with me and make the surgery. And I made the surgery very, very nice, completely. And I see all the patient, all the area, normal, because I see. And after the evolution, it was nice. She doesn't need to make the chemotherapy or radiotherapy, because her evolution was excellent. And this was 2.5 years after the surgery, and she continues right. And she continues, usually continue the hothouse. She buy the hothouse. And this is the first case in my patient, but I see this change, but it's real. And so only one case I cannot say. It's excellent. I need to have more patients. Right. But the problem is to get the patient to want to use the hothouse, etc. But in this patient in particular, I see a real change, because this cancer was very aggressive. And all people can say he's going to die in 4 months or 3 months and after surgery. But now she have 2.5 years, and she's continuing, right?
Wonderful.
Normal. Wonderful. Wow. For that, I love it.
You know, you may have already kind of
Yes,
answered
yes.
this question. It says in most of your presentations you talk about the hot house and the e-power. Can you elaborate briefly on the benefits of the hot house and e-power to your patients? You've probably covered most of that, but is there anything else you want to mention that you could elaborate on?
No, but only the patients is for all the doctors is very easy to use it, and there is no collateral effects. This is one of the most important aspects, because I'm a doctor, and when
There's
I
no
give
what
some,
kind of effects?
there is no collateral effects.
Oh, bad effects.
Bad effects.
Yeah, okay.
There is
okay.
no bad effects in after use it, because like a doctor, I give some medication, and people can feel if he comes with pain, head pain, and it bring teeth, and the patient come back after and say, okay, I'm fine on my head, but I'm bad on my stomach, and for that, after use of these devices, there is no collateral effect. There is no bad effects. It's easy to use, and so especially for hot house and e-power, can use it in my technique and feedback, but in all patients with have autoimmunity system problems. Example, arthritis rheumatoid, fibromyalgia, or multiple sclerosis, can use it. And I use it in all the patients when I make the surgery after cholecystectomy, after appendicectomy, after hernia, and I see, but there is less inflammation in the normal people, because too much people can say the device is only for people with problems, etc., diabetes, hypertension, etc. But it's not only for the people with these problems. It's for all people. It's for all world and all times. And I see, but after made the surgery, I see a change in the skin. Very nice. There is a faster recuperation and back at his activities. Well, for that sake, the people can use it in every situations.
And I've experienced that myself. I had hernia surgery, and I had one about 15 years ago, and it took me a month to recover severe pain. I had a second hernia surgery about a year and a half ago, and with the hot house, within the first day, 80% of the pain was gone. Within 2 weeks, I was totally healed, running up and down stairs again.
Yeah.
The doctor was totally amazed at, how did you heal so fast? And I said, well, I've got a device that I use, and they didn't really want to hear more details, but I just said, you know, I do something natural, and it works. So I know that the effects of the hot house are extremely powerful with healing, especially after surgery, quickly to heal it up or to avoid problems, you know, like I said, maintenance.